In this lecture, we will discuss left atrial enlargement, including its EKG features and potential causes. The P wave of the cardiac cycle represents atrial depolarization. So if we draw out our cycle here, a cardiac cycle, we have our P wave, QRS complex, and T wave. Here's our P wave, QRS complex, and T wave, okay? And when we look at atrial abnormalities, we're focusing here on our P wave, which represents atrial depolarization. In sinus rhythm, the P wave is generally upright in the inferior leads, especially lead 2, as well as in the left lateral leads. So that's leads 1, V4, V5, and V6. It is also inverted in lead AVR as the electrical axis heads away from that lead. As we will see, the criteria for left atrial enlargement assumes sinus rhythm is present. Now, if you recall, because the sinus node is the normal pacemaker of the heart and it's located in the upper right atrium, the right atrium depolarizes before the left atrium due to its close proximity to the sinus node. Therefore, because the P wave represents atrial depolarization and in the right atrium depolarizes first, that means the beginning of the P wave represents right atrial depolarization and the end of the P wave represents left atrial depolarization. Okay, so again, our sinus node is up here, okay, and it's firing starting at this point, and we'll start to depolarize the right atrium because it's right, that's where it's located, and then our left atrium. So when we look at our P waves here, okay, here's a P wave in lead 2, and then we have a P wave in V1. Okay, so this whole thing represents a P wave, and the same thing here in V1, okay? And what we're saying here is that initial portion, because our sinus node is in our right atrium, the initial portion of our P wave represents right atrial depolarization, okay? The same thing here in V1. And the terminal portion of the P wave represents left atrial depolarization, okay? And you see the same thing, this biphasic P wave in V1, the terminal portion representing left atrial depolarization, okay? So you can think of this first portion, right atrial depolarization, the middle portion, the end of right atrial depolarization plus the beginning of left atrial depolarization, and this latter third representing left atrial depolarization. So hopefully that makes sense. So this means if we have right atrial enlargement, we will notice that we have these problems, or we'll see changes in the beginning of the P wave. And then if we have left atrial enlargement, we're going to notice changes at the end of the P wave. Now with right atrial enlargement, we'll be looking for an increase in P wave amplitude, whereas with left atrial enlargement, we will mainly be looking for an increase in P wave duration and or depth, okay? So remember the end and our focus here with left atrial enlargement, because if the right atrium is enlarged, we're going to see a peaking of our P wave, but with left atrial depolarization, because it's representing the terminal portion, we're going to see a widening, okay? So things will go spread out and be prolonged, okay? And in the left atrium and in V1, we can see an increase in depth as well as an increase in the duration as well, okay? So the width of our P wave. Now, if you recall, the initial P wave vector is directed anteriorly as it depolarizes the right atrium, while the terminal P wave vector is directed posteriorly as it depolarizes the left atrium. And because the left atrium is enlarged here, it will produce greater posterior forces, and this is why we will see an increase in depth in the terminal portion of the P waves in leads V1 and V2 as they sit over the anterior portion of the heart, and the electrical axis is now directed posteriorly away from those leads. So if you look here, okay, here's our image of our heart. This is our right atrium. Let's use another color here. This would be our right atrium, okay? This is our left atrium, our right ventricle, and left ventricle. Okay, so our sinus node sits up here, and what it's going to do, it's going to fire and depolarize our right and left atrium. But what we have going on here is that now we have an enlarged left atrium. So imagine our left atrium is enlarged, okay? So it has much more mass and volume, and because of that, notice that the vector here in depolarizing the left atrium is greater than compared to our right atrium, okay? And remember, the right atrium, the right ventricle sit more anteriorly, so as this spreads from the right atrium, it's going to head towards the anterior leads, V1 and V2, but then when it depolarizes the left atrium, it's going to head posteriorly, okay? So if you had this heart, the left atrium is more posterior, so imagine the vector first coming anteriorly towards V1 and V2, and then it heads posteriorly to depolarize the ventricles, or the left atrium. And as it heads towards the left atrium, we're going to see these negative deflections, okay? And that's why in V1 and V2 sometimes you can see these terminal portion of the P wave, notice that it's directed negatively, whereas the right atrium, as the vector heads towards those leads, will be upright in V1. Okay, so our focus here is left atrial enlargement, so let's see what we should look for. Now, we said that we're looking at the P wave duration and depth with left atrial enlargement. First off, we mentioned earlier that this criteria assumes sinus rhythm is present. Now, because there are no significant age-related differences in the P wave, aside from a slight increase in the P wave duration throughout childhood, most of the adult EKG criteria for left atrial enlargement are applicable to children. It has been generally accepted that if the product of the depth in millimeters and the duration in seconds of the negative portion of the P wave in lead V1 exceeds negative 0.04 millimeter seconds, left atrial enlargement is suggested for all ages. Okay, so now we're looking at our criteria. And we're at this first one here, okay, where we're looking at the terminal portion of our P wave in V1. So let's just erase this here. Okay, so we're going to see, so we're looking at, again, the left atrial portion, the terminal portion, and we're saying that the depth, meaning the depth of our P wave from the top to the bottom, okay, in millimeters. And then we're also looking at the duration of it from the beginning until the end, okay, if you take the product of those two, okay, the millimeters of the depth and the duration in seconds, so millimeters times the seconds, it should be greater than or equal to negative 0.04 millimeter seconds, okay? And if you look down here, we actually can see that. Here's V1, okay? Notice we have, this is an actual real one, so this is our P wave. So notice that if we look at this as an example, we have a P wave depth, okay, from this portion to here, representing -1, okay? So let's say the depth is -1 millimeters, okay? And then we'd multiply that number by the duration of that P wave, that terminal portion. So from the duration of that terminal P wave, we see that it is greater than one small box. Remember, one small box is equal to 40 milliseconds. So as long as it's greater than that, and we certainly see that here, okay, the depth is actually around 2. So if we see the duration here, it's greater than 0.04, okay, we can obviously see this is going to be greater than negative 0.04 milliseconds, okay? It might be 0.08 in that case, okay? And remember that negative sign comes from the depth, okay? That negative here, okay? We're going down, so that's where that negative comes from, okay? So really, one way just to remember it, to make things simple, is if you look at the terminal portion of the P wave, okay, in V1, and the duration of it is at least one small box, okay, or 1 millimeter in wide and 1 millimeter deep, that's a sign of left atrial enlargement, okay, if you don't want to remember all this equation. All right, so really 1 millimeter wide, 1 millimeter deep, and you meet the criteria, okay. All right, now the other feature that may clue us in on left atrial enlargement occurs in lead 2. It may sometimes be referred to as P mitrale. If there are notch P waves in lead 2 with an interpeak duration greater than or equal to 40 milliseconds, as well as a total duration greater than 110 milliseconds, this would suggest left atrial enlargement, okay? So now this is what we call this P mitrale, okay? And we see that here in lead 2. So here's lead 2, and what we're looking at here, remember, this is our P wave, where you see that notching, okay? So you have a P wave that looks like this, okay? And what we're saying is that the duration of it should be greater than 110 milliseconds, because remember, 110 milliseconds is pretty much the upper limit of normal for the duration of a P wave in lead 2. So from here to here should be greater than 110 milliseconds. Okay, and we should also see that there should be peaking, where we see these notching of the P wave. So we're saying that the peak from this peak until this peak should be at least one small box, or 40 milliseconds. Okay, so this is called P mitrale. Okay, and we're saying again the duration of the P wave is greater than 110 milliseconds, okay, so about 3 small boxes, as well as the duration between these peaks, the interpeak, should be at least 1 small box, or 40 milliseconds. Now, one way to remember this is P mitrale is that the P wave actually looks like the letter M, okay? If you look here, this looks actually like the letter M, so you can think of that as P mitrale, same thing here, okay? Now, in terms of causes of left atrial enlargement, if it is isolated on the EKG, meaning that that's all you see are just these changes with the left atrium, then it's likely due to mitral stenosis. And you can start to associate P mitrale with the M-shaped P wave as well as with mitral stenosis as a common cause. Okay, so all of them have to do with the letter M, P mitrale, right? The M-shaped P wave and mitral stenosis. Okay, so you can kind of group those all together to simplify things. All right. Now, if left atrial enlargement changes are associated with left ventricular hypertrophy changes, then it may be due to systemic hypertension, aortic stenosis, mitral regurgitation, or hypertrophic cardiomyopathy. Essentially, anything that causes pressure or volume overload on the left side of the heart can lead to left atrial enlargement. And it's important to be aware that left atrial enlargement is often a precursor to atrial fibrillation. Okay, so again, what we're seeing here, if we just erase some of this stuff, so it's the left atrium that is getting enlarged. Okay, so imagine this left atrium is now spreading out, and we have left atrial enlargement, and we're saying that how this can happen was either from a pressure or volume overload. Okay, so if you look at our aortic valve, it's hard to see here. Let me just erase this there. So our aortic valve here, if there's aortic stenosis, we can see a backup of blood or pressure that ends up making our left atrium enlarged. Okay, hypertrophic cardiomyopathy, where we can have the septum hypertrophy and cause obstruction of blood, again can cause a backup of blood flow into the left atrium. Mitral stenosis, remember the mitral valve is between the left atrium and the left ventricle. So if this valve becomes stenosed, we can have a backup of blood. And that's one of the most common causes, especially if it's isolated on the EKG. Okay, so let's quickly review what we discussed before we end. So remember, the P wave, the initial portion represents right atrial depolarization, the terminal portion left atrial depolarization. Okay, the initial P wave is directed anteriorly, okay, and the terminal portion of the P wave is directed posteriorly. All right, now left atrial enlargement, there's two main criteria I want you to know, and they have to do with in V1, where we see that terminal negative deflection, in which the depth times the duration is greater than or equal to 0.04 millimeters per second, okay, or that's the, remember it's negative too because of the depth. All right, but remember, one way to make it simplified is knowing that 1 millimeter wide, 1 millimeter deep is an easy way to get to that criteria. In terms of Lee 2, we're looking for what we call P mitrale, okay, where we see that M-shaped P wave often associated with mitral stenosis. And in that case, we see these notched P waves with an interpeak duration of at least 40 milliseconds, as well as a total P wave duration of greater than 110 milliseconds, or 3 small boxes, okay? So hopefully that makes sense. Remember, mitral stenosis, if we only see these left atrial enlargement changes, it's likely due to mitral stenosis. So associate P mitrale, mitral stenosis, and the M-shaped P wave as we saw. Well, that's the end of this lecture. We discussed left atrial enlargement, including its EKG features and potential causes. I hope you learned something.